Hello, everybody. Good afternoon. Thank you for joining us for episode 6 of Interoperability Unlocked. If you are new here, I'm Courtney Baker, the marketing manager here at Commonwealth, and I'm always joined with Liz Lewis, our director of product. And Liz and I are super excited because this week we have a special guest. We have Dee Dee Davis of the Sequoia Project. Very thrilled. So, I know. Whoop, whoop. Dee Dee, would you like to give us an intro of yourself, the Sequoia Project, and kind of maybe the Taking Root movement that we're going to talk about today?
Sure. I'll try to do the really short version. Hello, everyone. My name's Dee Dee Davis. I work for the Sequoia Project. My title is Vice President of Informatics, Conformance, and Interoperability, meaning I wear lots of hats. I've been in this industry for over 30 years. Yes, I'm dating myself a little bit there. But I have I'm very grateful for having the opportunity to have been here at Sequoia now for 12 years. But basically what I do here at Sequoia is lead up our data usability work efforts, which we're going to talk about today, and a lot of other things under our interoperability matters, as well as leading 8 different testing programs. That's where the conformance piece comes in. And then all things interoperability. We work with the standards organizations. We work with stakeholders, including federal government, health information exchanges, electronic health record vendors, and other technology platforms such as yourself to really help make interoperability happen across the U.S. In a trusted and secure way.
Amazing. Well, like I said, we're very excited to have you here talking. No, that was perfect. Talking all things data usability. So first, let's get to kind of why this even matters. Why are we talking about data usability? Liz, I know you want to nerd out on this. It's near and dear to your heart. So why does this matter?
Yeah, you want me to go first, at least from my perspective? I'll give a little intro, I guess, on it. But as a network, right, we're the data movers. Dee Dee is focused on making sure that the data works for the systems that receive it, but we're the ones who are like funneling tons and tons and tons of data. And, our stakeholders, our members, their clients care about the data that goes in. And I don't think that they're always thinking about the data that goes out of their systems necessarily, but they sure do care about the data that's coming into their systems and what it looks like. And it's not always great. And we hear a lot of feedback around the types of data, the issues with the data, just the volume and duplication of data. And we have been a part of sort of a content work group for, dating back several years, Commonwealth and Care Quality working together, evolved into what Dee Dee is running now. And, I think it matters, quite frankly, all of the steps, all of the hops along this kind of interoperability healthcare ecosystem. But ultimately, it matters to the patient because we have the power of accessing all of this data, but the data and the ability to use that data is only as good as, how accurate it is, how clean it is, and the ability for a provider to interpret that information in a relatively fast way, the ability for a computer to compute that information accurately, because if the data is incorrect, then how can they compute it accurately? But ultimately, I think all the way downstream, it's the patient, right, who's going to benefit from their provider, their caregiver, their care team, whoever, having the right access to the right data at the right time, having it in a way that their care team can use it in a meaningful way, so that they have the best possible outcomes that they can have, right? I don't know. What do you think, Dee Dee? What do you think about that?
100% agree there. And I'm grateful, the Sequoia board and our membership, have prioritized this. So this is not a one and done. We've been working on this since 2020. Like you said, we built on top of the Care Quality Commonwealth, implementation guide that was published last in March of 2022. So, or in 2020. So we built off of that in our first version, and we've also added additional pieces of that in our second version. So you guys were way ahead because you were even further along. We've taken those pieces and parts and mixed them with other standards implementation guides to really think about how do you reduce the impact of duplicate data, because so much of these data sources now are refeeding the same information again. And that's not usable to a clinician. Where did the data come from? Originally, the provenance of it, that helps maintain that trust. So there's little pieces like that we can improve. We have all these wonderful electronic health systems, to your point, but if we can't take the data and semantically ingest it, we can't harness that power of the technology. We can't use it to actually help that clinician reduce the burden. Not that we want to add a bunch of clicks, but really having the information at that right place at the right time, but also back to the patient. So, just to add real quickly, why is it so important? I'll put a real patient experience. I had to act as a caregiver for my father for several months of this year. And I got to see the intersection of VA data, public-private institution data, what he could access on his portal. And by golly, I can tell you, we even have an information exchange in our backyard. And we have a lot of sophisticated exchange use cases like image exchange. I could get image exchange information, but I wasn't able to get some of that from some of the hospitals. So even though we have an HIE, even though we have some sophisticated EHRs in the hospitals in my backyard, we really still have so many opportunities for improvement. So I think that's what we're trying to do, is we're trying to make all of us those change agents to bring these things out so that we can improve it when we need it as a patient or a caregiver or whatever. So
yeah, absolutely agree.
So with the Taking Root movement, what is like the model of this group, and what's the role that like QHINs could or should be playing within that?
Yeah, I mean, from my perspective, there's not a lot in TEFCA that speaks to the data itself, because TEFCA is about, again, moving the data. It's a network of networks. It's Commonwealth has a network, and eHealth Exchange has a network, and Epic has a network, and there's these networks, and so the definitions and the requirements inside of TEFCA say, how do these networks work together to make interoperability work? I would challenge all of the QHINs, current, candidate, thinking about it, to be really serious about looking at this data usability movement, being a sponsor of it, being a supporter of it, evangelizing it, and bringing it back inside of their own communities, so that their clients, their connected organizations can internalize it and figure out, what strategies do I need to put into place to do better? A lot of, when I think about TEFCA, I think about it as an evolution of interop at a national scale, because, and Dee Dee knows, like, we've been doing interop at a national scale for well over a decade between our organizations, right? And that's fantastic. And we have some big lessons learned. And so for me, TEFCA is an opportunity for us to take some of those lessons learned and, bring forward the good and maybe cut away the things that weren't so good. And I think I'd love to see, a doubling down of the data that we're moving, and making it make sense and making it usable by the QHINs who are committed to moving the data, but should also be committed to making sure that data is more usable as we move forward.
Yeah, I think holding yourself accountable, I think that's really the key point. All of us, even if we don't we always talk about the data coming from others, but we do need to be accountable for our own data. If everyone just did that and started measuring it. So, I invite everybody, Commonwealth is a wonderful supporter, and I'm grateful for that, because you've been part of the Taking Root movement all along the way. But to your point, we need more folks, more organizations, more implementers. Not that you affect the change. You don't create the data from the data sources. You pass it through, but you're helping communicate to your stakeholders. So I think I would invite all organizations to think about being a supporter or an implementer, depending on what's more relevant to your organizational type, and join. We do have those monthly community practice roundtables where we do share those lessons learned and help each other to get there a little bit quicker. And quite frankly, network and say, here's how I did this to get this buy-in, or here's the result of implementing this that actually achieved this ROI. those talking points just help us help educate all of our connected stakeholders, because it's a hard job. It's not something that if it were easy, we would have done it already. That's
Yeah.
same cliche. So,
well, yeah, I mean, interop writ large, right? If it were easy,
right.
snap our fingers.
Absolutely.
Okay, so can you
Absolutely.
tell me, so Commonwealth is a supporter of
Yeah.
the data usability taking root movement, and you talked about an implementer. Can you tell me what is the difference between those two types of roles within this, movement?
I love that. So we do have two pledges, and there's no cost. So let's leave it at that. There's no cost for either one. There is a little bit different requirements if you sign up to be a supporter. Bottom line, it's simple. You're giving us permission to use your logo on a website, and you're invited to the community of practice roundtables that happen monthly. Get all the resources like readiness checklists, things like that we create, as well as technical assistance from the Sequoia Project for helping you get there if there's questions around the standards and so forth. Now, that supporter, the implementer goes a step further. It's those folks who truly have a health IT platform that creates data content. So they are a source of data. They can truly affect change. Now, it could be an HIE that aggregates data and creates an on-demand document. It could be an EHR vendor like an Epic or an Oracle or Athena Health or someone at the data source that actually creates that data and implements the guidance within that for their customers, their stakeholders. So, you put the link there. So so those are this link is where you can go and actually join and pledge. As an implementer, the other thing that an implementer has to do is they have to give us a scorecard. They have to tell us what's available in their technology platform so we can help educate others. We don't share that broadly, but we help use that information to educate others as we network, but also how many folks have actually deployed it, how many customers have this live and so forth. So we're trying to measure that rollout.
Yeah,
so
absolutely.
Those are the differences.
Yeah, makes total sense. Awesome.
So if we're recruiting right now, right? We want more supporters and implementers. If we were to wave a magic wand and make this a huge success for the Taking Root movement, what would the world look like? And what does that mean for TEFCA and the other frameworks?
You want me to go first on this one, Liz?
Yeah, go ahead.
Let's start with you, Didi. Sorry.
At least my vision. That's why I'm kind of the evangelist. I'm trying to make this happen. I'm trying to inspire others. So this is my opportunity. So in my perfect world, we'd have a lot more. We have right now 29 organizations who have pledged. So that's a number. That number needs to grow. So I think in a perfect world, I would have many more, and that we would all be helping each other in this avenue by sharing this information, because it's not one and done as well. Thinking about usability in all projects, people would have this top of mind, and in all reality, we would all benefit, not only as patients, but the whole workflow. All of us eventually being able to have the right information will allow us to hopefully help inform our clinicians as well. So I think it's a bi-directional piece. But the last mile, having all the last mile change agents actually implementing this data usability in all projects. That's my perfect world.
I would add just one, add on to that, absolutely one more granular step that I wanted to call out as you were saying that is, I'd love it if organizations could prioritize resources to be thinking about data usability as their primary, thing that they're thinking about in their job. Like for me, data usability is not in my job description, and it's not something that is admittedly always top of mind for me, because I, again, am focusing on the movement of the data, and we're not data creators. We're moving the data, but at the same time, I recognize the importance of it. I would love if, again, call to action type of thing. One, I think all QHINs networks should be paying attention to this, and at a minimum, be a supporter and be participating and be educating their communities. And then two, I would love it if organizations could have a dedicated resource to making this a priority, because it's all well and good to say, yes, I want to do better. I want to dig into the data that I'm producing and get a better understanding of what it is and what we're doing. But that is not easy. Like, let's just acknowledge that that is a challenge, and we're producing all these systems. You know, a lot of them are proprietary, right? They're
Right.
producing data in different ways. Data goes and sits in a table over here. Data goes and sits in a warehouse over here. How does it get generated? When it goes and is output into a CCDA or whatever, how
Right.
does that happen?
Right.
Right? How does the
Yeah.
data collection, like, this is not easy. So
No.
I want to underscore that. And I think that's why I wanted to add that point in, that I really think that organizations, vendors, health IT systems should make it a priority to have humans, resources allocated to thinking about this and investigating it and working to implement some of these things in your implementation guide and beyond, and even beyond that.
Yeah, keep it top of mind. I think that's it. Having somebody whose main job is to focus on it. To your point, it's not just do a little here and do a little here. It needs to be a roadmap. It needs to be ongoing. And you've got to think about it every time you add a new data source.
Yes.
You add a new interface
Yes.
feed, you've got to reanalyze what could I do to optimize that better? Why am I going to do this so that I can help the folks?
I just think about these like super old HL7 results interfaces that are coming into systems that have been live for a decade or more, that are just using like system generated codes, and nothing is mapped and nothing makes sense and nothing can
lab
be trusted.
interfaces.
Oh,
You're describing
man.
lab interfaces. They were all slammed in with meaningful use dollars, and those interfaces haven't been touched since like 2011 or 12 or 14.
Who even knows like how things are being mapped on the inside? It's
Right.
So that's what I'm with you there. I think, but it to me, like, especially as a kind of type A person, it can seem very overwhelming. But I think your implementation guide, what it's great at is that you didn't try to boil the ocean. You said, okay, here's the priorities, here's the things we're going to tackle. So if you guys take a look at the implementation guide, there's actually now 2 versions. There's a new version out as of late last year. You can see the build upon version 1, and it's not boiling the ocean. It's very actionable. Here's, provenance that we want to take a look at. And especially as you think about, you have direct data sources coming on board through EHR vendors. You have HIEs coming on board that sometimes have the same data sources behind them. Exactly. And we want to make sure that we understand, for patient Liz Lewis, like, where did this data come from? It doesn't matter all the hops. Like, I need to know what provider system.
Where was the original source? Yeah.
What's the original source? Yeah. So super, super important.
And that's it. Our charter is that we do this in incremental steps. I call them baby steps, taking baby steps. It's better to take a baby step, but we are trying to also, where appropriate, align with regulations. So with the newest regulation for US core data for interoperability, we did from first version to the second version, add full coverage for that. Now, that's a big step, but to your point, if all of us are making little thoughts about, even if we just think about the provenance, there's 7 chapters in our implementation guide. It's about 60 pages, but that's with divider pages and all of that. So we tried to make it short and sweet, but there's a lot of linkages to existing standards. And I think that if we could just start looking at a provenance section, or if lab is a problem for you, you're an LIS vendor or someone that is beating your head against the wall. Why aren't the hospital not keeping my original LOINC code that was sent to them? Because that'd make it easier. Those kinds of things that just make the world a little bit easier. So
absolutely agree. All right, so I know we're kind of like, we're supposed to be doing this for 15 to 20 minutes. It's a self-imposed.
I talk a lot. You can blame me.
Yeah, no. Same. I could go on and on forever. Okay, really quickly though, what's been your favorite part of founding this movement? I mean, obviously you're super passionate about it. You've been in the space for a while. You've been doing big in the standard space for sure. But this specifically, data usability, what's been your favorite part?
Seeing the actual change actually happening. It's not happening as fast as I want it, but what's been exciting is seeing, like, I had one of our implementers report that all of their customers have this implemented now. That to me was a huge milestone.
So exciting.
I mean, actually seeing that actually start happening. So again, that's one implementer. We got to get more of those over the fence, but all the implementers need to start doing that. So I think that's been the exciting piece, is actually seeing the change happening. Even though it's taken a little longer than I want.
Yeah, absolutely. Awesome. Courtney, you want to do
So-
some rapid fire questions in our last few
Yeah.
minutes?
I was just going to warn Dee Dee
Are
that
those going to go to just Dee Dee? Like I can sit this one out, or what do you think? No, these
let's
are
have you both answer. You have to both
Okay.
answer, but you got to keep it short, Liz. Okay.
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 Oh gosh.
So we end every episode with some rapid fire questions. I've got 3 for you guys today. First one. What is one word that describes the current state of data usability? One word.
Fragmented.
Dee Dee, you first. Fragmented.
Fragmented.
Problematic. I mean, that's the first thing that
This is
came
like,
to my
what's
mind.
a,
Broken.
what's a synonym?
Broken.
I thought
Problematic.
broken, but I thought that's too negative.
Yeah,
Let's make
yeah.
it fragmented.
Fragmented is great. It's a nicer way. Yeah, yeah.
I mean, they're all synonymous, right? Okay.
Hi.
Which is worse, missing data or misformatted data?
Oh gosh. To me, both. I can't pick one.
Yeah, I agree. I think it's both. I think if you, if I had to pick, the only reason why I would say misformatted is just because of the rise of AI. And I have a really very serious, scary feeling about incorrect, wrong data going into AI algorithms and having an output that is incorrect based on
That would lead to patient safety. Missing data, you don't have patient safety issues as much, although missing data may also include patient safety because you don't have the right information.
Right.
I don't know.
Yeah,
You're right.
That's really,
But
really hard. You can start going down a rabbit hole of how scary. I think, Dee Dee, maybe we should do like a horror story book of like bad data, horror movie. Like, I think
that would get people's attention, right?
You could, like,
Let's do it in
could really go down a rabbit hole of how scary something could be based on, garbage in, garbage out.
Yeah, for sure.
Sorry, that was not rapid fire.
That's okay. Okay, Dee Dee, I'm going to have you close us out though. What's the biggest win that you've seen from data usability or the taking root movement? I know you said national change is like the most exciting part, but what's a big win? Like tangible.
Another big win. So I've already mentioned one vendor, so that was the biggest win. But the next one is I've been working with one whole state who's actually taking pieces of this to deploy it across the entire state. And I'll just call out, it is one state known as Texas. So we'll give them credit because they're doing so much work.
This is Catherine West, right?
Yes, it is.
Yeah.
Fantastic. We should have her on sometime. Yes, high five to Texas and to Catherine. She's been pushing on this too. So I love to see that. That's great.
Yeah, for sure.
Yeah, absolutely. We did a great panel at the Fall Summit last year with her and Dee Dee, and that was amazing. So
she's a rock
no surprise
star.
to hear that one.
Yeah, and Phil Beckett, they're rock stars.
Yeah.
So
love it.
Amazing.
Awesome.
Well, Dee Dee, thank you so much for joining us today. We dropped the link in here for all of you viewers to go check it out. The implementation guide, the most recent one was in December. So we look forward to chatting again, and we'll see you in 2 weeks.
Yes. Thank you, Dee Dee. Yeah. Thank you so much for being here.
Have a great week. Take care. Bye.
Bye.